everyone, welcome to my YouTube channel. My name is Gia, and in today's video I want to continue my journey with Dr. Ellie Phillips mouth care system. And I started my journey back in February of this year, and now we have August, the beginning of August, so it's been a couple of months, 5 months actually. And I can tell you the following. I had comments about, can you show us before and after pictures? Well, I can't, because I didn't make a picture before. As you may know, in the previous videos, I talked about a problem of mine that are receding gums. And of course, I was terrified, not happy. I was looking for a solution. And I don't have any visible results yet. Of course, I hope I will get them, but so far I can't show you any huge visible results. But I can tell you two things that have improved tremendously in the past 5 months. And this is enough proof and enough evidence for me to say that this works, the system works. And if it takes me a year to regrow my gums, I'm fine with it. That's okay. But I'm seeing results, I'm seeing that I'm progressing, and that's all I need to see. So that's why I'm not taking before or after pictures, because for me right now, the most important thing is that, number one, I don't have any tooth sensitivities anymore, which is huge. I've had tooth sensitivities for the past 5, 6, 7, 8 years maybe. It was horrible, you know. For those of you who know what I'm talking about, it's you can't eat hot, you can't drink cold. When you eat chocolate or sweets or anything sweet, like a banana, your tooth hurt because it's sugar and it creates sensitivity. So it was terrible. It was really bad. And that's about 2 years ago I started looking for solutions because it was that bad. So that's why when I started buying really expensive toothpastes, and nothing worked. Really nothing worked, and I didn't get anywhere with it. So the one and only thing that changed something for the better was Dr. Ellie's mouth care system. And that's why I'm standing here in front of you and sharing this information with you, because I really want you to try it if you haven't tried it yet. And if you're doing it, I'm certain that you're on a great journey, and maybe you can leave a comment about your journey. I would be thrilled to hear your story about the mouth care system. Another thing, finally, after these many months, I have decided to tackle the Xylitol. So I started out with mints. The mints were okay, but they were not my favorite. So I decided that maybe I'll try, you know, the crystals. So I bought the Xylitol in the supermarket. You know, it's like half a kilogram. You can buy it 500 grams. It's just a neat, nice little package, but it's not small enough for the purse, of course. So I also bought myself this little box. And why did I buy this box is because it's really cool. You know, nothing comes out of it, and that's perfect, because here you have the Xylitol, and if you don't want it in your purse, you just close it up and you put it in, and everything's fine. The way I use the crystals when I'm at home is I wash my hands, and then with a clean finger I just dab in twice maybe, and then I put it on my tongue, and yeah, that's it. When I'm out and about, when I'm in a city, I have a spoon with me in a separate little box. I always have a spoon with me because it takes me a lot of time to get from A to B, and then I need to eat something, and then I need a spoon. So I've gotten accustomed to carrying a spoon with me. So In the evening I wash it, and then so on, you know. So I always have a spoon with me, a clean spoon. And yeah, so when I'm outdoors, I just take a little bit of the xylitol on the spoon. I think that a spoonful is about 4 to 5 grams. And as I remember, Dr. Ellie recommends between 6 to 10 or 6 to 9 grams. I'm not sure about this, but I'm sure that it's at least 1 teaspoon, at least. And I think it's more. So yeah, as you see, I'm diving into the xylitol topic, and I'm trying hard because it's not easy for me. I don't eat any sugar. And I think that this is the hurdle for me, because my mind thinks that this is sugar. And I also have the feeling that if I have xylitol in my mouth, I produce too much saliva, if that's even possible, I don't know. But that's just my feeling. And when I have this, let's say that I buy a xylitol mints, I have this feeling that I'm like having a candy in my mouth. So, you know, when you don't eat sugar and you're convinced that sugar is not good for you, and this tastes like sugar times 10, it's so sweet. For me, it tastes like this right now, because I haven't eaten sugar for many months now. I think it's been 2 years, something like this. And so if you don't eat sugar, then xylitol tastes really sweet on your tongue. And so as you see, I'm struggling a bit with this, but that's nothing new, right? For the ones that that you've watched videos before, I've had struggles with what's this called? Closes. This is the closes in my tiny bottle. And I also had big struggles with this here, the Listerine. Yeah. One more thing that I need to talk about, because this is something that I haven't found anywhere on Dr. Ellie Phillips' page. Because I want to know what causes gum problems. And I think I found somebody who is really, really good at this. His name is Dr. Joel Wallach. And this is a doctor who was a vet before he became a doctor. And he describes it in simple terms. He says that if you have gum problems, you have a deficiency of calcium. And it does make some sense in my situation, because on my last blood test, I remember that I wasn't really very much deficient. And the blood test was 2 years ago. So I have to repeat my blood test. And the calcium levels 2 years ago were really on the low end. They were not in the red area, but right on the border. And I didn't take this serious. And I remember that there was another hormone, parrot hormone or something like this. And this thing was also on the super low end. So it does make some sense, you know? Maybe it's just calcium deficiency. So I'm really looking into this, because I think that there's a reason for everything. And I don't want to just do the right dental system to have healthy teeth. I want to, yeah, strengthen them. So, yeah. So that's another thing that I wanted to talk about, that there's a doctor, and maybe I will also post some clips of him talking about it, because it's really eye-opening that, of course, there must be a reason, right, that we have this problem. Yeah. All right, so that's it for me today. So right now my xylitol journey has begun. And yeah, please let me know how you're doing. I love reading your comments about your journey. Let me know how you're doing, and I see you in the next. Bye bye.